Welcome to This Week in South Carolina. I'm Gavin Jackson. While COVID-19 continues its stranglehold on the state of South Carolina, a new disaster cropped up literally overnight earlier this week. Tornadoes. More than a dozen tornadoes spawned earlier on Monday morning and claimed 9 lives in South Carolina. We have the latest on that situation and other developments from this week. The week began with empty churches as folks watched Easter Sunday services at home on live stream or outside churches across the state. At St. Peter's in Columbia, Father Gary Linsky gave his Easter homily to 2 parishioners.
The good thing about the coronavirus compared to other national tragedies such as 9/11 and other experiences like that is that we're all in this together. I was an Air Force chaplain for many years. I was in Iraq, Afghanistan, and just about every place in the Middle East. And back in that day, 1% of our country was involved in fighting, and leaders of different political sides kind of said, look, let them fight, we're going to act as normal as possible. Well, I think the unifying factor in this case is that everyone's suffering. And I think in a way that will cause us to be stronger.
But within a few hours of Mass, things dramatically changed in the state.
We have a new disaster on our hands now, of course, with the tornado. Destruction is enormous. The trees broken off, big pine trees halfway up with no limbs on them and the top's gone somewhere. Big oak trees ripped up, houses smashed, everything smashed but the spirit of the people in Seneca. It's quite a sight.
And that spirit was on display a day later in Seneca, where volunteers were helping out across the area and residents were still trying to make sense of it all.
Because we could have been killed. The ceiling fell in the house. I just don't know how to explain it. I've never been through anything like this in my 65 years. Between the coronavirus and the storm, I know to pray that much harder.
One of the most breathtaking sights was the destruction of the Borg-Warner plant in Seneca, where an EF3 tornado a half-mile wide chewed up the massive metal building and spit debris like metal siding across its 16-mile path. It killed a security guard, one of 9 South Carolinians who died across the state. All in all, more than a dozen tornadoes, including several destructive EF3s with winds up to 160 miles per hour, were reported in the upstate, Midlands, Grand Strand, and Low Country. At the Low Country Regional Airport in Walterboro, more than a dozen single-engine planes were strewn across the tarmac like children's toys in the wake of the destruction. The physical damage of the storms seemed to highlight the already difficult economic situation facing South Carolinians from the coronavirus shutdown, which has the governor planning for an economic jumpstart soon.
But the main thing, what we hope that we can do, is we can get our economy started back again, get this economic engine going. Every business is essential to somebody, particularly the one working there. But we want to get all these businesses going back as soon as we can. And to that end, we will be announcing before long a plan, a rejuvenation plan in order to get our economy started again. But now's not the time to let up. We have to keep on going and keep working together and following the advice and recommendations that come from the official sources. And I believe that we'll make great progress and we'll come out of this very well.
And I'm joined with Sara Goldsby. She's the director of the South Carolina Department of Alcohol and Other Drug Abuse Services. Sara, good to be with you.
It's good to be here. Thanks for making some time, Gavin.
Yeah, we appreciate it. Sara, it's a difficult time. It's been several weeks now. We've been in this difficult situation with the COVID-19 crisis, and I'm guessing that it's also compounded for people who are suffering through substance abuse disorders. And I want to ask you a little bit about what that means for these people and how it's been, and how maybe people can cope with this situation right now.
Yeah, I think you really hit on our top concern, which is that the circumstances with the COVID-19 situation really can drive anxiety, depression, fear, and isolation in anyone and everybody. And, with all of that comes, the urge sometimes to drink or to use substances to cope with those feelings. And so in a situation like this, we're especially concerned about folks in recovery from a substance use disorder and others who may not have really addressed a problem yet, and then those who are developing a problem currently just with the circumstances and that prolonged isolation and drinking.
So when we look at, the isolation, how does that affect people? Maybe people who are already maybe in recovery, or people who are still abusing. Does this drive up any potential for overdose deaths or anything that you guys can point to at this point? How do you measure this situation right now?
Yeah, it's tough to measure currently, but there's an old saying that folks in our world use, and that's that the opposite of addiction is connection. And that really speaks to, how folks reach recovery is almost always through connection, and that meaningful connectedness to others who are in recovery and recovery allies. I think when folks, are isolated like this, feelings of loneliness, a sense of fear and despair, especially for those folks who are being impacted with the loss of their jobs, all of that can really drive a sense of wanting to escape those feelings. And an easy, way to escape feelings is to misuse substances or to use alcohol. Unfortunately, folks turn to those things. And so we get the sense that right now, a lot of folks are trying to manage in the day-to-day with this difficult situation. And if folks are turning to those substances and to alcohol, we're going to see an immense need for treatment services and recovery services in the near future. And again, folks just want to reach out and feel connected. So, recovery typically looks like mutual aid. We imagine mutual aid groups, AA, NA, happening every day with a lot of social connectedness in person. Those recovery services nationally and locally have gone online, which has worked really well. We've heard from folks that you could be in a recovery meeting around the clock if you wanted to, through Skype and other virtual methods. So there are ways to connect. I think our concern and our intention has been to keep people connected as a top priority, both to treatment services and to recovery services.
And Sarah, you were mentioning how you expect there will be an immense need for treatment services after all this. Maybe let's focus on alcohol because it is so readily available regardless of crisis or in normal times. I'm wondering, do people, are they drinking more, do you think? Again, trying to maybe escape because they're not getting that connection so much. How does it maybe turn into a problem? Some people might say, hey, leave me alone. I've had a long day. Even though we're working from home, there's different stressors right now. When do we start seeing things maybe shift into a problem from just your average, I'm going to have a glass of wine, turns into I'm going to have a bottle of wine or more?
Right. It's an excellent question, and it's something that we're talking about every day. Something that we're seeing just in our own social networks on social media, this growing norm that, well, I'm home, the kids are here, that's an added pressure, and I may start drinking, in midday. And a lot of jokes about, well, I had a glass of wine with lunch or, had a beer, several hours earlier than the after-hour norm. And what we're going to see is a whole lot more of that, right, being normalized in a social sense that will lead to folks having an issue when they may not have had one before. Folks who will cross that line from social use into misuse and really seeing a problem with not being able to slow down or really using that daily as a method of coping with the situation.
So how do we pump the brakes on that? How can people recognize those signs and say, okay, maybe I'll wait to my normal time, or not normal time, but after a happy hour per se, or with dinner instead of in the middle of the day, or making sure that people are aware. I mean, is it just because it is becoming normalized? We do see people joking about it, and I think that's the first step for people thinking, oh, it's no big deal if everyone else is doing it, but obviously everyone's different. So is it a matter of realizing this could become a problem? Take it easy, be aware.
Absolutely. Awareness is key, and I think conversations in the home are essential, especially with adolescents and with each other. Checking in with each other personally, with our friends who live alone, and asking the hard questions. I think holding each other accountable. Accountability is key right now, and I think anybody in recovery would tell you that accountability is essential in a time like this when we're isolated. We know that now is the time for conversation, and we have put resources and materials and conversation guides on our website, SCDAODAS.gov, because we want families and friends to be talking things through and recognizing it with that acute awareness.
And switching from alcohol to other drugs, opioids obviously still a big problem in South Carolina. A lot of people are in treatment. I'm wondering how they're affected by these times. Obviously sometimes you go to a methadone clinic, you go to different places to get treatment. Is it more difficult now to get that kind of treatment, or are treatment centers adapting to this situation? What's that been like, and is that also, maybe having some accountability issues for people when you say it's so important at this time?
Yeah, I feel really proud of DAODAS and all of our providers who have worked extremely hard in the last few weeks to make sure that there is no lapse in services. Right now, statewide, anybody can get into treatment over the telephone and virtually. We've worked with our opioid treatment providers, our folks who deliver methadone services, to make sure that they're implementing their emergency plans. We are authorizing for their stable patients 14-day and 28-day take-home doses so that they're not having to come to the clinic every day to get that medication. And with our county alcohol and drug authorities, we've made sure that they have all of the technology and the reimbursement to offer telephonic and virtual services for new patients and for existing patients. So no services have lapsed. Mm-hmm. And the bright news is, with the technology that we're using virtually now, reports are that we have no shows. There's really no excuse to not show up for treatment. So the success is there, the tools are there. It's just a matter of making sure everybody knows where to go to get those services. Mm-hmm.
And when we look at substance use disorders, obviously, I've read a stat that about 50% of people who do abuse drugs have some sort of issue with mental health. I'm wondering, how do you address that, and how maybe people can also be aware of that situation when they are, again, self-isolating, distant from people, and social connectivity?
Right. So anybody who's prone to anxiety or depression or any other mental disorder is particularly vulnerable right now. And a lot of that is what drives the drinking and the substance use. I think being aware of the symptoms of those mental disorders, the anxiety, the depression, and really looking for coping skills that are healthy to address those. Not to mention, services are available statewide, especially through the Department of Mental Health. But recognizing some of those drivers and the healthy coping mechanisms, and staying connected, reaching out to friends and family, really having as many conversations as you can by the phone or virtually, so that we're not losing ourselves in those disorders to the isolation. Mm-hmm.
And we're still in this crisis with opioids too in the state. And I know you were supposed to have the Governor's Opioid Summit in March, and that's when a big time for your organization and other partner organizations to review what's going on and ways forward to deal with this. We haven't got new numbers for 2019 out yet. You said it was going to be in August, but I'm wondering, when we look at the numbers right now, how is South Carolina faring when we look at the ongoing opioid epidemic? And are we making any progress? Is it still slow going? What's it been like still when we look at those numbers?
Even though we don't have the mortality data yet, and we won't have that till the end of the summer, we know that we've made some progress. We've got indications that our treatment admissions are up nearly 400%. This time than they were last year. They've just really climbed. We've gotten so many patients into treatment, into stabilization. When it comes to overdoses, we have been extremely concerned in the current circumstances about overdose. Like I've just been saying again and again with the isolation. In the last few weeks, we've tried to push out about 7,000 boxes of Narcan statewide to make sure that overdose antidote is available in every single county to anybody who might need it, no questions asked. those community distribution sites can be found on the justplainkillers.com website. We want to make sure Narcan is available because what we've seen with EMS data since January until now, compared to last year, January until now, we've had about a 23% increase in the number of overdose responses. And so while we've made some headway, we've brought a lot of folks into treatment and gotten them stable. We know we have a long way to go. And the immediate objective is to make sure we keep people alive. And that's as it always has been, just really making sure that everybody in this situation has Narcan and can keep somebody breathing in the case of an overdose.
So it's still a pretty difficult situation when you look at, like you said, more people going to treatment, but then also still seeing that increase in overdose-related EMS calls. I mean, that seems like is that good or bad when you look at both those numbers at the same time? How do you read that situation?
I think, we've always said that the problem was so much bigger than we ever knew. And the problem has evolved over time, especially with access to more potent illicit substances. I think we've talked about this before. The illicit substances coming into the United States are more potent this year than they were 2 years or 3 years ago. And so the access and the availability to those extremely dangerous substances has changed, and I think that's what's changing the numbers.
Mm-hmm. And then, Sarah, obviously staggering numbers right there when we're talking about that opioid addiction and the overdose situation there. Just when we talk about other addiction, we have about 3 minutes left. We've been talking about alcohol, drugs. Again, people are cooped up in their homes. Maybe they're, watching more TV. Maybe they're becoming a little bit more inactive. Maybe they're eating more food. I'm just wondering, what other addictions should people be watching out for during these difficult times, these unusual times when we're not used to this situation right now?
Yeah. Well, always, our state statistics have shown we have the greatest prevalence of alcohol use disorder. Second, we have marijuana use disorder, and then we really see the tobacco use disorder and the stimulants and depressants, so opioids, cocaine, and methamphetamine. But I would say we can't forget about gambling. Gambling, especially with the loss of so much income, with the hit to the economy in this situation, always looks like a hopeful promise. But, we're always amazed at how many calls our agency gets with families whose savings accounts have been drained, checking accounts have been drained by somebody in the family who has a problem just with the basic scratch-off tickets. Or other issues, and I expect to see some of those issues increase as well. So again, awareness is the key, and healthy coping mechanisms are essential at this time.
So a lot to be looking out for then. Just with 30 seconds, I know you just said healthy coping mechanisms and awareness, but anything else, it's direct advice for people out there right now watching, thinking, that they really can't get out of a situation, economically or maybe drinking. What's your advice right now for people who might just feel stuck?
I would just say so much help and support is currently available, and we would really love for folks to call our office or seek a local opportunity, because the recovery community has blossomed in a way that's offering services virtually, and we have treatments statewide for anybody who needs it, regardless of their ability to pay, and it's all available telephonically and virtually at this time. So calling the SCDAODAS office, 1-800-662-HELP always gets our office, and then visiting our website, SCDAODAS.sc.gov. And for information on Narcan and opioids specifically, justplainkillers.com has so many resources that everyone can use.
Sara Goldsby with SCDAODAS, thank you very much for joining us.
Thank you, Gavin.
As you heard, Sara was talking about how mental health has become a bigger issue during these difficult times. And our telehealth team has this look about what the medical community is doing to help.
This is a tough time for everyone. Certainly our patients who already struggle with anxiety, depression, isolation may have an exacerbation of symptoms. But those of us who may have not previously struggled with any of those symptoms may find ourselves now feeling anxious, feeling concerned and worried or uneasy.
Jennifer Butler is with the South Carolina Department of Mental Health. At a recent press conference about the COVID-19 pandemic, Butler spoke about the need to bring attention to mental health.
And as we've been talking about making sure we're caring for our physical health, we wanted to make sure that we drew attention to paying attention and care toward our mental health. The Department of Mental Health and many other resources are here to support you during this time.
During the coronavirus outbreak, more mental health providers are turning to telehealth to close the gaps between providers and their patients.
During this COVID-19 situation, where the recommendations have been either to stay at home or shelter in place, telepsychiatry, it's just blossomed.
That's Dr. Chris Pellick, the medical director for telepsychiatry at the Medical University of South Carolina.
We're able to expand our coverage to take care of patients in their own homes and not put them or the healthcare professionals at risk by bringing them into a clinic or a hospital for medical appointments. We can do that right where they are.
Telepsychiatry is the use of technology to connect patients and mental health providers. This could include a phone call or a live video chat like Zoom or FaceTime. Last month, the federal government relaxed some regulations on telehealth to expand providers' reach without bringing patients into the hospitals where they could be exposed to COVID-19. Dr. Pellick says telehealth has allowed MUSC's psychiatry team to see more patients from home.
In our department, we've universally taken all of our outpatient programming and converted them to telehealth. And in doing so, we've expanded the number of people doing telehealth. We've expanded the locations telehealth is being done.
At MUSC, Dr. Pellick estimates about 100 more providers using telepsychiatry now than before the pandemic.
During COVID-19, we're seeing patients mostly in their own home, although some are going to doctor's offices in rural locations, and then we're dialing into that doctor's office.
He adds, the pandemic will have a lasting impact on how mental health care is delivered.
I do believe, though, this will sort of change the landscape for mental health, telehealth, probably forever. Given the way this whole thing unfolded with COVID-19, it's shown that we as a medical system have to have flexibility in how we deliver resources.
Increasing access to mental health service is especially important now. Butler says the stress of the pandemic could make mental health symptoms worse, but the Department of Mental Health says that help is available to anyone who needs it.
Please stay connected during this time. It's important that we not lose sight of each other, even though we may be physically a little bit further apart. As we stay at home to save lives, we still need to stay connected. So if you are feeling suicidal, we urge you to call the National Suicide Prevention Hotline at 1-800-273-TALK.
Schools in South Carolina have been closed for more than a month, and it's unclear when they'll reopen. So parents, students, and teachers are learning a new way of learning. Holly Bounds Jackson has visited a Low-Country family to find out how they're coping.
Read it all together. Go ahead.
Billy Dre of Bluffton is leaning on her 9-year-old daughter Maya to keep her younger brother on top of his letters and sounds. Like parents everywhere, the mother of 5 found herself managing her full-time job at home while overseeing her kids' assignments.
Shelby, don't push buttons. Because we have 3 school-age kids that are in Beaufort County schools. That's 3 full days worth of activities and learning and all of that.
The COVID-19 pandemic pushed South Carolina Governor Henry McMaster to close schools statewide through the end of April. That's when educators made a quick shift to e-learning. In Beaufort County, teachers are using Zoom, a video conferencing platform that allows students to log in and meet with their class in the most normal way possible.
We've trained over 1,600 staff members through the use of Zoom. With Zoom, teachers can share their screen, they can create presentations, they can do live polls, they can pull up whiteboards and interact with the students. It gives a lot of great features that teachers do in the classroom that they can just continue doing virtually.
April Scarborough lives in the coastal empire of Georgia. She operates an animal shelter and guides her 9-year-old son Ian with his lessons throughout the day. There are challenges that come with doing both at once, but she's accepted the fact she has no choice.
So homeschool's been a little bit different for our family. I am what's considered an essential personnel, and we are still having to do intakes. I'm still having to do adoptions. So my son has to come and do his homeschooling with me at work. It has been an interesting experience for sure. He's used to volunteering out here with me on weekends, but now that he's out here with me every single day that I'm working and trying to create a structure for him that still allows me to get done what I need to get done has been a challenge for sure.
And you have to put the healthy food right here. Good job.
Schools are trying to maintain as much normalcy as possible from afar and working to keep morale up too. PE teachers post videos to keep the kids moving, and Red Cedar Elementary School continued on with their planned ceremony, awarding children for their classroom performance as they watched from home.
Respect with honors, Gael Gomez Villegas.
Middle schoolers are turning in their big projects in a different way.
This project is for Miss Rebuild's 6th period class.
Perhaps getting a little more time to shine, showing off their hard work.
And to the republic for which it stands, one.
It's an experience for the books, and Scarborough best sums it up for all who are making it happen.
But we're just making do the best that we can. We were not ready for this. I don't think anybody really was, and we're just doing the best that we can.
To stay up to date on the latest COVID-19 news in South Carolina, check out the South Carolina Lead. It's a podcast that we're dropping multiple times each week to keep you up to speed on what's happening on the ground here in South Carolina. You can find it wherever you find podcasts or on southcarolinapublicradio.org. From South Carolina ETV studios, I'm Gavin Jackson. Thanks for watching, and be well, South Carolina.